I was discussing about the clinical features. Let's talk about first symptoms. Fever. These are the things which is complained by the, which is told by the patient. Fever, abdominal pain, chills, anorexia, weight loss, nausea, vomiting, right shoulder pain, and the irritable cough. Signs, of course, when we will examine, there will be splenomegaly, tenderness. Tenderness can, if you allow me, can I involve all of you? Can anyone tell me about the tenderness? What is basically what is tenderness? Okay, tenderness is nothing but pain on touch. Tenderness we can only say that pain on touch. Whenever we apply a pressure, or only there will be pain. This is nothing but the tenderness. Rebound tenderness, when remove that particular hand or the examination hand, the pain would be called the rebound tenderness. Jaundice would be there, but of course late. This would be late feature, and the portal zone infection and the surrounding hepatocytes infiltrated with the polymorphs. Let's talk about the investigation. Very important investigation, because whenever there is a presentation of disease, we have to go to the various types of investigations which are very important to rule out or to come to specific diagnosis. In routine, there will be anemia, WBC, leukocytosis. If you go for the blood culture, organisms will be present, and the liver function test, LFT, elevated serum alkaline phosphatase, most reliable thing. Elevated serum bilirubin in the 50% cases, elevated aminotransferase 48% cases, hypoalbuminemia 33%, and chest X-ray CXR, elevation of right hemi diaphragm, right basilar infiltrate, UHG. Differentiate as a round or the oval area, hypoechoic fluid filled area. UHG, there will be fluid filled area. If you go for the CT scan, cluster sign is very important. Let's see what is cluster sign. Seen when multiple small abscess aggregate, meets, which suggests beginning of the coalescence to single abscess. That will form a single abscess. This is called cluster sign. Let's talk about the MRI. MRI findings: raised lesion with the sharp borders, because there are very ulcers or the ulcers or the MRI or X-ray findings. There are raised lesion with the sharp borders. Aspiration of the material. If you aspirate the material, diagnostic and the therapeutic, it is used for the diagnostic and the therapeutic purposes. Let's talk about the treatment. Start with the empiric antibiotics, ampicillin, metronidazole, gentamicin. Specific antibiotics depending on the cultures, and specific antibiotic can only be started once we get the culture report. 6 to 16 weeks if persisting percutaneous drainage under the USG and CT guidance. Surgical drainage. Indications for the surgical drainage. What are the indications that can decide that surgical drainage is required? Abscess with the intra-pathology requiring surgery. Ascites if multiple large abscesses. Abscesses large. If abscess size is more than not more than equal to 5 centimeters in the diameter, it can respond good to the metronidazole. But when the abscess size is more, it must be drained. Abscess which cannot be drained percutaneously. Amoebic liver abscess. Another type is the amoebic liver abscess. Commonest extra-intestinal presentation of the amoebiasis. Amoebiasis. This is the commonest extra-intestinal presentation in the form of the amoebiasis. Common in the alcoholics, because initially I told that alcoholics and the toddy users are more prone, and the people who use junk food and they are unhygienic, they live in the unhygienic conditions, and entry by the fecal-oral route. Amoeba make it entry into the system by the fecal-oral route. Pathology. Amoeba multiply, block in intrahepatic portal radicals, focal infarction of the liver cells, and that focal infarction is blood supply is restrained or stopped. That leads to the focal infarction of liver cells. Proteolytic enzymes released which destroy the liver cells, the liver parenchyma site. Right lobe of the liver, supra-anteriorly, just below the diaphragm, large necrotic area which is liquefied in the thick reddish brown pus. This is called the anchovy sauce pus. We are very much familiar with this terms. I will show you the picture of this anchovy sauce pus. Due to the liquefied necrosis, this sauce or the pus is because of the liquefied necrosis, thrombosis of the blood vessels, lysis of the liver cells. Histology. Necrotic area containing, because necrosis is very important for the formation of the pus. If you look for the histology of the necrotic area containing the degenerated liver cells, leukocytes, RBCs, connective tissue strands, and the debris. This is basically not debris, it is debris. Most of the people read it as debris. It's not debris, it's the debris. And amoeba. Clinical features, if you talk about the clinical features, symptoms, high-grade fever with the rigor, weight loss. I have already discussed about this. Jaundice, not in the initial stage. This is the table on my, on your left side. This is basically correlation between the abscess size and the liver function test in the case of the liver abscess. Fever. Fever is the found in the 96% cases, and pain abdomen in the 92% cases, and vomiting 20% cases, and nausea 48%, and jaundice 8%, cough that is 24%, and abdominal tenderness 64%, hepatomegaly on examination 88%, anorexia 46%, pleural effusion because of the liver is very adjacent to the lungs, and ascites, of course, 4% cases. Signs, hepatomegaly with tenderness, consolidation in the right lower zone of the lungs, and pleurisy. If we talk about the complication, one should not wait for the complication to occur. We have to be very alert, and we try to limit the disease as soon as possible, because we should not wait for the complications to occur. So if it ruptures into the lung or the pleura, there may be empyema, hepatobronchial fistula, pulmonary abscess, and the pneumonitis, pleural effusion. Rupture into the pericardium. If it is ruptured in the pericardium, intraperitoneal ruptured into the portal vein, this is very rare. Secondary infection may be there. Investigation, already discussed, HBTLC, DLC, leukocyte liver function, already discussed. Stool examinations for the systemic trophozoites. Let's have a look on the screen. This is anchovy sauce pus. Very important. This is a pigtail. If you see very attentively or carefully, it is look like the tail of the pig. So it's basically inserted for the drainage of the pus, because we cannot go for the aspiration from the syringe on the day-to-day basis. So we keep the drain and measure on daily basis until and unless the pus drain is 0, and that indicates that pus is absorbed 100%. Without that, we cannot allow the patient to leave the go for the treatment. In admitted patients, injection pipzo, it's a piperacillin and sulbactam, 4.5 grams with normal saline 100 ml, IV TDS, injection metronidazole 100 ml, IV TDS, injection on them for the vomiting, injection PCM, SOS whenever there is a fever, and the 1040 for the as a PPI. This is the combination of the pipzo, piperacillin, and the tazobactam. Injection amikacin 500 mg IV on the BD basis. Syrup neoguardin, it is for to counter the loss of appetite, because loss of appetite is there. Patient is low weight, underweight. Syrup sancillin, it is also for the enzymes which is disturbed in the liver disease. If response continues, if response is there, then continue for this treatment for the 14 days. If no response, we go for the percutaneous drainage. This is salicylate syrup. It is silymarin, ornithine, and the L-aspartate with the B complex syrup. I have taken very little in the from Unani section because I will present in another time. In that I will focus only the Unani aspect. Today I have tried on more on the allopathic portion of this. Dubela kabid. Dubela kabid in the Unani which is called dubela. Kabid means liver. It is usually produced after the worm har, as in the salabate jigar, which is produced after worm bari, kuraje kabid, and dubela kabid. When there is single large abscess in the liver, it is called dubela. If abscess, because in liver in the ultrasound finding as well, I discussed about the focus of the pus. So when there is single liver focus or liver abscess, it is called dubela. But when it is small, it is called courage. These are some references. Besides, wait. I will tell you for the planning. Actually, there are very myths about the diet, what the diet one should take and what the diet one should avoid in the case of the liver abscess. Most common cause of the liver disease, if we sum up in this common easy language, unhygienic food. People who used to go for the street foods, so there may be chance for the fecal route. And alcohol is also one of the most important because alcoholics are there whose immunity is weakened, and they are old age as well, and comorbidities. If the patient or if the person who is suffering from the liver disease, he may suffer from the diabetes mellitus and the obesity. If these two comorbidities are there, there may be chances to recur or worsen the condition, and that will lead to the more severe condition of the liver abscess. If you want to strengthen your immunity, and if you are non-vegetarian, then if you are non-vegetarian means then you can go for the egg, chicken, fish, rich source of protein. We should take the rich source of protein. One myth is that some people say that they only use the fruits. Fruits, of course, fruits are good, but fruits cannot give you protein. They can only give you water. They can only give you nutrients. So it's not advocated that you use only fruits. Fruits are there; they must be with the other proteinaceous diet. So you never say that I only use fruits. Fruits use, but on the limited basis and not on the continuous basis. And if you are vegetarian, then you go for the milk. That will increase your immunity. Paneer, soybean is the rich source of, and pulses. This is called the poor man's milk. Pulses are a very important source of protein. And the chana, rajma, chole. These are the some things which vegetarians can go for. And curd, milk is also there. Dry fruits. If you talk about if you are so high, you belong to the so high socioeconomic, then you go for the dry fruits like badam, almond, and walnut, flaxseed. It is general notion that when you are ill, you should only consume fruits, but this is not right, as I told you that. If you are liver abscess patient, what things you must be avoid? Salt restriction. You must restrict your daily salt intake and maintain water. Water, you should be maintain your water intake. In liver disease, increased accumulation of the water is there, so you cannot go for the more water. In general days, you can go for the 2 or more than 3 or 4 liter, but if you are liver abscess patient, in that case, limit your water intake because there is a condition of retention of water that may worsen the condition. So, in the case of liver abscess, do take care of your water intake. and limit that. In normal person, 4 to 5 liters per day water is required, but not in the disease of liver abscess. And if precautions are there for precautions, we talk about precautions. Deep fried, foods or the junk food. I have already discussed pizza. You can say burger, samosa, butter, oily food. Avoid cotton seed oil. And one more thing I want to add that we use vegetable oil in the homes, and that must be changed time to time. For example, you use soybean oil for 2 months, for another sunflower oil for another 2 months. So keep changing your vegetable oil. That will add or some more things if something is deficient in that particular oil. If we talk about the incidence of the liver abscess, who are the people who are more prone? Actually, initially I told that old age persons whose immunity is very low, and diabetic patient. Diabetic